Health Focus is brought to you by National Medical Stores, NMS, passionate about your life.
According to the World Health Organization, mental disorders vary and present differently. They are generally characterized by a combination of abnormal thoughts, perceptions, emotions, behavior, and relationships with others. Alan Nsubuga is dealing with the effects of bipolar disorder, one that causes extreme mood swings that include emotional highs and emotional lows or depression. Nsubuga is a clinical psychologist by profession.
I would either sleep too much or I would have so much energy, and I was like, okay, what is going on?
In 2019, Nsubuga hit the peak of what he says was the price for living in denial of his condition, a complete mental breakdown.
By the time that I went for help, I could not even get up and, do anything.
Dr. Benedict Akimana, a psychiatrist with Butabika Hospital, says the work we do has an impact on our mental health.
If your work is to impress the people at work, who all they want to know is what you deliver, but not your well-being, then that becomes toxic. Because at the end of the day, you wake up and you want to please your bosses at your workplace, but they are not wondering what happens.
He says employers should routinely assist their employees to speak about mental health to avoid breakdowns.
Let's provide services for people to come through and, talk about their challenges, talk about what they're going through.
It is estimated that 1 of every 7 people here in Uganda has a mental health challenge. Unfortunately, the Ministry of Health, which is in charge, does not know how much of a problem they have to deal with at hand. Dr. Hafswa Lukwata is the Acting Assistant Commissioner in charge of mental health and control of substance use.
We've not had a national survey to ascertain the prevalence of the different mental health problems that we have. And that said also, even people do not come within the health facilities. We are seeing an increase in the numbers that are coming, but we still feel that that's just a small number of those that are out there.
For that reason, coupled with fear to speak out, the ministry incurs huge losses in trying to deal with the problem.
We've put medicines. The medicines are everywhere. By the way, unfortunately, our medicines are the ones that are expiring in these facilities. Dr. Lukwata says they need more support to appropriately deal with mental health. We need to monitor service delivery across the country, but also we need to supervise those that are offering care. A 2022 report from the World Health Organization showed that 1 billion people globally were living with a mental disorder in 2019, and 15% of the working-age adults experienced a mental disorder. A 2019 study by the Health Ministry and the Uganda Counselling Association showed that an estimated 14 million Ugandans suffer from some form of mental disorder. The overall objective of World Mental Health Day is to raise awareness of mental health issues around the world and to mobilize efforts in support of mental health. Walter Mwesije, NTV.
National Medical Stores, NMS, passionate about your life, with support from the Ministry of Health. Procure, store and distribute essential medicine and medical supplies to all government health facilities in Uganda.